and we'll have it available to you at a later date. So I would like to introduce some of our staff who've been instrumental in putting this webinar series together. Dr. Jeanette Manchester, who's our Assistant Dean for the Center for Professional Development. Dr. Manchester's waving now. Our Program Assistant for Professional Development, Marielle Rosario, is also monitoring the WebEx today for us. And there's Marielle, she's waving. So they've done a great job in coordinating everything behind the scenes. And now it is my great pleasure to introduce Dr. Donna Gaffney. Dr. Gaffney is a dear friend and colleague of mine for many years, and we're very pleased to have her here with us, as well as Millie Elia. And I will introduce Dr. Gaffney, and I will let Dr. Gaffney introduce Millie to you. So Dr. Gaffney is coordinating this webinar series, and she is a Rutgers School of Nursing alumna. She has a long history of addressing trauma, loss, and grief in the lives of children, adults, and in communities. As a psychotherapist and consultant, Dr. Gaffney has worked with families, schools, and professionals in the aftermath of tragedies such as the Challenger explosion, the Pan Am 103 crash, Sandy Hook, the Haitian earthquake, and after Hurricane Katrina. Following the terrorist attacks on September 11, 2001, Dr. Gaffney was a member of the New Jersey Traumatic Loss Coalition and the State of New Jersey Disaster Mental Health Services, working with Liberty Science Center, communities, families, and professionals. She served on the Families of September 11th Advisory Board and facilitated one of the first online support groups for family members affected by the 9/11 terrorist attacks. We are very fortunate to have Dr. Gaffney with us today, and I know you will enjoy and appreciate her presentation. Welcome, Dr. Gaffney.
Thank you. Thank you so much, Anne Marie. And I wanted to just, Millie, can you show us who you are again? I just wanted to introduce you to everyone. There she is. Millie is an advanced practice nurse, long history, working in thank you, Millie, with patients as a nurse practitioner. And several years ago, she actually started her own business, so health and wellness business. So she's going to be the one to give you the tools that you need to practice relaxing and getting comfortable. So without further ado, let me begin. Thank you all for coming. I spoke with many of my colleagues over the past month, and we were watching what was happening on social media with nurses talking to each other. And they began to express a lot of issues about how they were struggling with their work, with the consequences of the pandemic, and how they were short on equipment, but the emotional and social impact of working with such very critically ill patients. So we began to collect those narratives and began to identify what the issues were. And there are many, as many of you may know. I know that many of you are students, but I'm sure you've heard what some people have been talking about, and certainly what people are reading about. So I got together, Anne Marie called me, Dr. Morrow called me, and we talked about what we could do to help our professional colleagues. And at first we thought, well, maybe there's one webinar, and then it didn't take too long to realize that it really needs to be a series because of the varying issues that our profession is confronting. So that's how we came up with the 7-session webinar series, and we're completely aware that there may be more issues, and we will be willing to tackle those as well. We want you to know that we have your back on this, and we really want to provide for you the kinds of things that you need to not only do your job well, not only to survive this pandemic, but certainly to thrive and to learn a little bit more about yourself and how you can be much more comfortable. There's no way that we're ever going to be completely comfortable in this very difficult situation, but we want you to have the tools and the strategies to be able to function to the best of your ability and really do well. So we began to talk to several different colleagues, and that's why you will see a number of different people involved in this particular project. So let me begin by just showing you a little bit. These are some of the people involved. So we have, their bios are on the next page, and I won't read through those. You can look through those at a later time. Dr. Peg Pitchick, who is on the screen, is a psychotherapist and a marriage and family counselor as well. And so she's going to talk about transforming helplessness to wholeness. And she can also talk about some of the issues that arise when people go home to their families, and we have a lot of fears and concerns about that. And Dr. Ann Hoffmeyer is actually going to be joining us from Australia. She has done a tremendous amount of work in the area of compassion, and she's going to share some of her strategies and goals that she has for working with nurses. So I'm just going to skip that because you can look at that another time. We want you to know that this is a safe place for you, that we want you to take care of yourselves, even hearing the content that you're going to be listening to. We are not going to be using any graphic images. We don't want to re-traumatize people. We get enough of that on the news. So we want you to take good care when you are in this session, any of these sessions. And if it gets to be a little much at any point, just turn down your volume, get up and get a drink of water, shut your eyes for a moment, or stop it for, and then come back and revisit it later. We really want you to know how important it is to take really good care of yourself. And that means exposing yourself to issues that, maybe you've encountered at another time in your life. And this whole pandemic is bringing back some of those issues. We're certainly hearing about a lot of difficulties. We're hearing a lot of nurse testimony. We're hearing a lot of family testimony. So if it is too much, take a breath and step back. And Millie's going to give you some of those tools to use as well. So this webinar series is really going to be supporting you in not only your professional life, but your personal life, because it's very difficult to separate the two. We want you to know, we want you to be able to recognize the kinds of issues that are occurring in your professional life as well as in your personal life. And we're also going to give you activities, exercises, and resources that will enhance your own self-care. The goals of all the webinars are really going to be to help you thrive and to really understand. Each webinar is going to be 60 minutes, and we'll have maybe 50 to 60 minutes of content, except that I'm dedicating the end of every session for Millie to weave her magic and help you, process some of this and do some breath work, maybe some chair yoga. So we will be raising awareness and encourage participation from all of you. And we want you to be able to ask the questions, no matter what you think about whether it's an important question or not. Please ask the question. So today we're going to be doing what we carry, and I'll tell you a little bit more about that later, where that comes from. And the second session is really welcoming self-compassion, self-care, finding support. And we really see these first two sessions as a foundation for the next group of webinars. And none of this is, required reading, although we really think that it should be. You may choose from the different webinars, although we think that it would benefit everyone to go through all of them. And then the last one we also think is super important in that it's really transforming that helplessness to wholeness. And the question you're going to ask yourself is how do I get through this? And even for students, I mean, it's really hard to have your mind on schoolwork when the world is a crazy place and you're listening to family members, and gets very, very difficult. So why self-care? Why self-compassion? Very often I will talk about this, and I've done this work for a very long time and have worked with people, nurses, social workers, psychologists, trauma specialists, about protecting yourself using self-care. And very often I will hear people say, well, I don't have time. I am here to tell you that you must make time, because once you sort of lock this into your everyday activities, you won't be able to do without it. So, and you'll hear more about why that is so crucially important. So one of the classic examples of why self-care is so important goes back to when we fly on an airplane. So how many times have you heard the flight attendant say, now in the event that the cabin loses pressure, the oxygen will drop from the ceiling, and we want you to put the mask over your face first and then put it on another person's face, this child or someone who's more vulnerable than you. As soon as you notice you're suffering, you automatically embrace yourself with compassion. This is sort of the exact message we want you to know, that if you don't protect yourself, if you don't put on that oxygen mask first, you won't be able to help anybody else. Not only your patients, your colleagues, your family members. You have to take care of yourself first. So you're going to see a lot of this particular artist's drawings throughout these webinars. Charlie Mackesy is from the UK, and he just has this extraordinary way of saying exactly what needs to be said about any issue. So in this one, it's, and I urge all of you to, he has a wonderful book as well. I think I actually have it right here. I just sent it to a friend of mine. Great book. And it's really about how we take care of ourselves and how we take care of each other. So when we're out of our depth, said the boy, because there's 4 characters he uses, just breathe, said the horse, and hold on. And sometimes that's all we can do is breathe and hold on. So next week, we're going to be talking about how do you welcome self-compassion and self-care into your life, and how do you find support. And we're going to be talking about your ability to provide self-compassion, which is a very separate thing than self-care. It's the foundation for self-care, but it's about being as kind to yourself as you can, as you would be to another person. We want you also to, we'll be talking about how do you find support in your life and in your work and in your personal lives. So many times over the past week, I've heard people say that it's really hard for them to talk to someone who's not in the healthcare professions because they don't get it. And so finding support means finding someone who you can talk to, no judgment, and they just listen. And being present is really crucial. We also have to recognize toxicity in relationships and environments, and that is when you feel worse after talking to someone, that's time to really recognize that maybe that's not so helpful to talk to this individual. And we also want you to identify and practice mind-body self-care strategy, and you're going to hear a lot more from Millie about that. The next session is offering compassion and comfort from a distance. I've heard from so many people that we're so used to being very close to a patient or very close to another individual, and we can't do that anymore. We can't do that for the duration. We don't know how long it's going to be. And anybody who's ever watched a commercial film in the past couple of weeks and you see a couple hugging each other on the screen, or you see a mother hugging her kids or grandparents hugging someone, I guarantee it's going to bring out in you that response of, oh, I can't do that anymore. And we miss it. We miss it. Anybody who's watched Governor Cuomo's press conferences, he talks about this all the time, about how he can't physically touch someone. So everyone is speaking about this. So we're going to talk about how we can be present for our colleagues and patients, develop actions that enhance compassion and comforting, even though we are not there, and reaffirm compassion for ourselves and for others. And this photo made its way, I hesitate, by the way, to say it's gone viral because we don't really want to talk about viruses that way in today's lingo. Anyhow, this is a gentleman who wanted to say thank you to the emergency room staff, and he brought a sign and held it up to the window and so that the nurses could see it. And actually, I found out later this was at Morristown Medical Center here in Morristown, which is where I am. So we find new ways to communicate. As a psychotherapist, that's one of the very first things we learn, that we can be present, we can be comforting, we can be caring, be very focused without actually touching another individual. So those are things that you'll be learning over the next weeks. So this offering compassion and comfort from a distance is, again, something that we need to know how to be present for our colleagues and patients and developing those actions. And when bearing witness is too much to bear, this is a photograph from the flu pandemic in 1917, 1918. You will see a lot of traumatizing images, and you need to know how to protect yourself from those images and recognize vicarious trauma and identify how and when we can ask for help. It's just really very important. We're also going to be talking about facing grief and grieving. And there's been a number of stories on the news about people who are saying goodbye to their loved ones using phones and iPads. And this is, again, calling us to use the most high-tech strategies that we have for us to be the intermediary between that patient and their family. We're really serving a very important purpose. So your role in a family's mourning are going to be very, very crucial. And how do we talk about it with each other? And how do we recognize vicarious grief, which we haven't talked about very much, but we're surrounded with loss right now, and as would be every person in our country right now. So I think one of the what I've heard from nurses who work in palliative care and also nurses who work in HIV/AIDS, that they to be present when a loved one is dying is a great gift and a blessing. But for us as healthcare providers, as nurses, to be there at the moment when you are when you are the intermediary between a family and a patient, that is a privilege for all of us, and it will change your life, and in a very positive and a very good way. And I think that all of us can take heart that it's easy to say, I won't know what to do, I won't know what to say, or I have so many critically ill patients, but it's really crucial for us to know that we play a very, very important role at that moment. And you're also going to be hearing about a very interesting and important strategy called the pause. And we'll talk more about that when we get to that session, because it's really very powerful moment, and not only helps the nurses and physicians address that moment when a patient is no longer alive, but helps us really heal ourselves as well. We're also going to be talking about families and relationships and how they matter, because I can guarantee that anybody who's working in a very critical area, emergency department, you've heard people say that every ER is Every ER is now an ICU, and ICUs are at overload. And when we bring this home, and we may not intentionally bring it home, but comes in the door with us. And so our families are looking at us and they're checking us and they're making sure, okay, and I'm sure they're wanting to rescue us and say, why do you have to do this? Or why do you, this is, not good for your health. So they're trying to be helpful, but they're really talking about their own, their own concerns for us. So when we have a family, now we go home and our families are socially distancing as well. And again, I'd like to pause for a moment and say, we're really not socially distancing. We are physically distancing, but staying socially connected. So I think that's a really important point to make, so that we're physically not close, but we do want to stay socially close. We want to stay socially connected. We can't let the virus take that away from us or for our families. Also, how to make a workable plan when practicing physical distancing and social connections. And I think when I saw this photo of the adult and the child talking, and then there's the crevice in between the two of them, I think a lot of families are feeling like that, and especially in some cases where health providers are actually afraid to have their children living with them, and they send them to a friend or a grandparent to stay away from them, so that the concern is that we don't want to make our family members sick. We don't want to get sick. We don't want our family members to get sick. And there's also tension in relationships. There's been this sort of funny, maybe not so funny thing going around saying, well, there's going to be all these babies born, 9 months from now. And also there may be a lot of relationships that are struggling 9 months from now, because it's tough to live in such close quarters with other people that we love and may not get along with at various times. And so we're going to talk about that. And also to discuss this longing for normalcy. I actually spoke to a colleague of mine, a friend who's a Jesuit priest, the other day, and he said that he woke up in the morning and he couldn't get out of bed. He said, I can't believe we're going through this. This is so surreal. This is not normal. And I think, how many times a day do we say that? That is completely appropriate and very commonplace to say that. And we after September 11th, we also talked about the new normal. And I think Dr. Fauci said last night on an interview that we're not going to be at the normal that we're going to see in the coming months and years is not going to be anything that we're used to right now. And the last session will be transforming helplessness to wholeness, and that is to recognize and accept our vulnerability. Anybody who follows Brene Brown knows that she talks about vulnerability all the time. So sometimes we have to acknowledge that. We also want to reframe uncertainty and fear, and really think about how that moment can change our lives and how we think about fear. And we're going to talk about resilience as well. And it's okay to be fearful. There's a lot that we don't know about our current situation, our uncertainty. I talked to so many moms and dads who said, gee, I wonder when we're going to be able to go back to school and when the kids are going to go back to school. And what we saw in the first week when people were living, working, schooling under the same roof, it was kind of a lark. There were lots of funny memes and jokes on the internet, and we could all smile and say, oh, isn't that clever? Isn't that funny? And then towards the end of the second week, it wasn't so funny anymore, that kids were struggling. A number of my clients have said that they didn't know how to help their kids. And so some of the strategies early on were about managing time. Now the strategies are about managing our children and how to help them through these situations. And probably one of the best pieces of advice. And I did do a whole webinar for on dealing with the schooling, living, working under the same roof. So if anybody is interested in that information, I can share that. That, you know, she said that she noticed her kids were more anxious and they didn't know, you know, what to say, and they didn't want to do their work, and they didn't want to, you know, listen to their moms or dads. And she finally said, and then the elephant in the room came out, and her little boy said, are you going to get sick? Am I going to get sick? Is grandma going to get sick and die? And so there it is. And that's what we have to talk about with our family members. But there's also the moment when you realize you've connected with someone, and that really sets the stage for ongoing, you know, communication that is so very important. And how can you make a difference in your, identifying your best actions and approaches? And that is what works for you. Not everything works for everyone. And so you find the strategies that really work best for you. And then making a difference in your own life and the lives of others. You know, to paraphrase that great American patriot, Mr. Rogers, he talks about always talking about the helpers. You know, when kids get afraid, when we get afraid, you know, what's going to happen to us? Will we be, is this going to be like this forever? And he points out you always look for the helpers. And, you know, we have so many people that are really making a difference in our lives right now, everyone from grocery clerks to the people that are the custodians. And it's, you know, of course, all the healthcare providers, no matter what profession. So what is it that we can do to make a difference in our life and the lives of others? And we begin to see some of that now as people are sharing sort of healthy goodwill stories. And those are the kinds of things. I especially love the ones by kids who are, you know, boxing up lunches, or all the young computer wizards who are using, you know, printers to make things for other individuals. So it's balance that you need to begin to really stay very aware of those things as well. We have to balance, you know, the very difficult things that we hear about with all the good things that we hear about. And so ultimately we want to have every one of us emerge from this pandemic, whenever that might be, whole and on a journey of healing and growth. So that's what we're going to be covering. I'm going to actually go back to the first session, which is what we're doing today. This is based on, some of you may have read this book when you were in high school or college. Tim O'Brien is an author who wrote a book about his experiences in Vietnam. I'm sure you're saying, all right, now enough of the military. No military comparisons, because there's a lot of them now. But I have actually used this particular exercise with children, and they get it. So in O'Brien's book, he talked about what the soldiers carried on them. And as I began to think about the kinds of activities that would be helpful for people, I couldn't help but think about everything that all the practicing nurses, docs, respiratory therapists are wearing now. Their bodies are covered. They have multiple layers on. And if there's any truth to it, and I know there is, we carry a lot of things in our pockets as well. We carry things in our backpacks on our way to work. So I thought that maybe Tim O'Brien's work would allow us to begin to think about some of our own baggage that we carry. And it's important baggage. And so I'm going to ask you a couple of questions in a few slides. But first, let me just reframe some of what he talked about and how I think that it fits with us in this environment. So Tim says that the things they carried were largely determined by necessity, things that they had to carry with them on the battlefield. And I'm thinking about the things that practicing nurses carry with them into their practice settings. They were necessities, he said. Can openers, pocket knives, wristwatches, dog tags, mosquito repellent, chewing gum, candy, cigarettes, salt tablets, package of Kool-Aid, lighters, matches, sewing kits. Now, I don't think that we need to carry C rations and canteens of water, but I know that we're carrying a lot of those other things in those clinical settings. He also said that they carried the sky, the whole atmosphere. They carried it, the humidity, the monsoons, the stink of fungus and decay, all of it. They carried gravity. I cannot think of anything that's more appropriate and apropos to the kinds of things that I've heard my clients and the nurses in my own circle of friends and colleagues, and that they talk about what it means to be in that environment. Everything from the smells to the sights to just the closeness and, yes, the humidity, all of those kinds of things. Necessity, he says, are the things that they carry because it's standard operating procedures. They all carried steel helmets that weighed 5 pounds, including a liner and a camouflage cover. And again, I can't help but think of that. Reminds me so much of the PPE that the professionals are carrying. He also says they carried all they could bear and then some, including a silent awe for the terrible power of the things they carried. He also uses humor. Some carried Bibles, some carried comic books, some carried condoms, and they carried photographs. They carried photographs of their family members, and they carried what they carried varied by mission. Some more complicated than others. So I think that also holds true for what we're experiencing. The things they carried might be determined by good luck, images, or good luck things that they carry, rabbit's foot. They carried jokes, they carried humor, and we certainly know that's true of in very intense areas in our profession. They carried the sky, and again, I'll go back to this, the whole atmosphere. They carried it, the humidity, the monsoons, all of it. They carried gravity. And I think that is something that we are all carrying now, whether we're practicing in those very stressful areas or we're supporting people. We talk about, you've heard it lots of times on the media, there's the, they're on the front lines, the nurses and the doctors are on the front lines. But then there's also all of us that are in the trenches that are backing them up. We're picking up their work, but we all are living and experiencing, the heaviness, the weight of what is going on in our environment. Now, just to tell you how I used it with kids, they got it right away about carrying pictures, and some of them carried pictures. This is one little girl carried a picture of her mom when she was pregnant with her, or her mom's favorite cookbook, and pictures and images of their family. And of course, kids can also relate to backpacks because they carry such heavy backpacks on their way to school. So they really talk about that as well. So that's very effective with them. So I want you to think about, and we're going to have a poll question come up for you to answer this. So what do I carry with me about my work, my colleagues, my family, my life, my memories, my emotions, what lessons I've learned, what are my hopes and dreams? What am I carrying right now at this point in time? So you'll see the poll question come up. So I want you to take a few minutes to answer that. And just take your time, and you can come back to it later, because we want you to think about this. and work can be your schoolwork. So let me just give you a few moments to think about that.
Jeanette, you need to open the poll. It's ended.
I'm going to go on to the next slide, and you can continue to write your answers, correct, Anne-Marie and Jeanette, the wizards of WebEx.
Yes, that's correct.
Thank you. Thank you. So it seems that this would be a good time to breathe as you're thinking about these things. And some of you may have had the experience of doing some breath work. And you're going to have an opportunity to do that again in a very few minutes. So I think that we'll have, going to actually have I'm going to give you a few more minutes, and then Millie is going to come on and walk you through an exercise. Our hope is, and our gift to you is that we give you an exercise to use every week. Every time there's a session, something different. And for some people, it will be comfortable, and for other people, it might not be. So you're going to be able to pick and choose what things work best for you. So again, you can still have time to answer the question. And Millie, I'm going to turn it over to you, and you have the floor, or you have the screen.
Hello, everyone. I am so honored to be with you today. Thank you for attending this very important webinar series. Again, my name is Millie Elia. I am an advanced practice nurse. I'm also a yoga and meditation guide, a yoga instructor and meditation guide. And today I wanted to explore an exercise that helps us to shift from a fight and flight response or sympathetic response to a more calmer state or parasympathetic response. This is vitally important whether you're a student, on the front lines of nursing, and even in your personal life. One of the main ways we can do that is by beginning to notice our breath. So for today's session, and every week I'll be doing a different exercise, we're going to look at Dr. Andrew Weil's 4-7-8 method. If at any time or for any reason, this exercise doesn't feel comfortable to you, or there are parts of it that you'd rather not do, you can simply follow along, and watching your breath is sufficient. The exercise starts by bringing the tip of our tongue to the roof of our mouth. And what I'll do is explain it first, and then maybe we can all do it together. Once the tip of your tongue is at the roof of your mouth, just behind your teeth, you'll want to inhale naturally through your nose and begin to exhale completely through your mouth, making a whoosh sound, and that can be done silently. So inhaling and exhaling, closing your mouth at that point, and begin to inhale quietly through your nose to the mental count of 4. At that point, you would pause your breath for a count of 7. And begin to exhale completely through your mouth, making a whooshing type sound to the count of 8. Now, these numbers don't have to be exact if you prefer a smaller amount of inhalations or a pause that is a little bit shorter. You can always alternate, but the main thing is having the exhalation be longer than the inhalation. That is an example of one breath, and we'll do that all together, bringing the tip of our tongue right behind our teeth, beginning to take a natural breath, and then exhaling completely through your mouth, through pursed lips if you like, if that feels more comfortable. Closing our mouth and inhaling to the mental count of 4. Pausing or holding your breath for the count of 7. And then exhaling with that whooshing noise through your mouth for the count of 8. That cycle can be repeated up to 4 times in total. And it's recommended by Dr. Weil that you can try that starting once or twice a day. It can take some time to get used to. It may feel a little bit uncomfortable in the beginning, but if you can tolerate it, it's an easier exercise to remember, and it's something you can do anywhere at any time. The other exercise that's equally as valuable is becoming aware of your body, and that can be done silently and at a seated position, laying down at any point in time during your day. And that's called, one method of doing that is called the body scan meditation. Many people believe that, or have told me that meditation does not come easily to them. But there are many forms of meditation, and this is just one that I'd like to explore with you today. If you can, become more comfortable in your seated position, bringing the soles of your feet flat on the ground. If your legs are crossed, I'd ask if you wouldn't mind to uncross them. Leaning back in your chair, becoming as comfortable as you can, and beginning to notice how your body feels as a whole. Breathing a natural breath, allowing the inhalation through your nose to begin to fill your belly like a small balloon. Becoming comfortable and begin to notice the soles of your feet and the floor beneath you, fully supporting your legs. Begin to notice the chair fully supporting the weight of your body. Allow yourself to take some slow, deep breaths, filling your belly, then your chest, coming all the way to the tops of your lungs, just under your collarbones. Bring your attention back to your feet and begin to observe, without judgment, any sensations you may have in your feet, your ankles, and your legs. There's no judgment with noticing how these areas of your body feel like. It's simply an observation. Notice your breathing at this time, continuing to breathe slowly. And if you feel any areas in your leg, in your feet, that may have a little bit of tightness, a little bit of tension, see if by breathing through slowly, you're able to release some of this tightness. Perhaps shifting your body ever slightly in your seated position, you're able to make yourself even more comfortable. Begin to notice your knees and your thighs. Again, we're just noticing these areas and not bringing any type of judgment. Begin to notice your belly, your hips, and your lower back. Finding that gentle curve in your lower back and noticing what that area feels like. Bring your attention to your middle and upper back. All the while remembering your breath, breathing slowly through your nose. Bring your attention to the front of your body. Again, with no judgment, notice the softness of your belly. Begin to become aware of your arms at your side, noticing what position you've chosen for your hands at this moment. Just as we did with our feet, begin to notice the palms of your hands, noticing if there's any sensations, starting with your right and moving to your left. Begin to notice the weight of your arms at your side. Bring your focus up to your shoulders, noticing if they're riding high near your ears or sloping away softly. Pay special attention to the tops of your shoulders. This is an area where many times we don't even realize there's tightness. And notice if you're able to soften any of that tightness at this moment. Notice where your shoulders meet at the back of your neck, at the base of your neck. Follow that up to that small curve we have, that perfect curve that supports the weight of our head, allowing us to look up, see what is in front of us. Notice what the back of your neck feels like as you become aware further up of your scalp, noticing any sensations lingering at the crown of your head, the top of your head, before coming down and beginning to notice your brow, finding the structure of your face, your cheekbones, the softness of your cheeks, finding firmness and power of your jaw. Follow the line of your jaw up and begin to notice the outline of your ears, noticing what you can hear from the sound of my voice, to any other noises or shifting of bodies around you. Become aware of your thoughts as they move by, noticing them simply as if they were clouds in the sky. When you're ready, become aware of your entire being again. Your arms, your legs, your thoughts, and your breath. I'll leave you with that. Thank you very much. And I'll return the floor back to Donna.
Thank you. So some of you may have used those techniques in the past, and they do work. You can use them even when you're at work or at school. You know, especially for the students, now that you're at home in front of your computers, you're sitting a lot, and it's really important for you to get up and walk around and move, and maybe do maybe do this breathing exercise in that interim, getting something to drink, to eat, to stretch, because it's really easy to just sit in one place for a long time. So, and I'm sure that Dr. Morrow probably also suggests those things as well. So we want to have time for some questions, and I think Jeanette was, and also if we thought we might even share a few of the things that people are carrying and give you some thoughts about that, and to give yourself a chance to respond. So Jeanette just fired off a whole bunch of them to me. So one person said that she or he always carries water with them, and sometimes a religious charm with them, mentally and emotionally carrying the family with them, since they've always been one's greatest support. And I think that this is a time when we really have to acknowledge how much our families support us and mean to us. So I think that that's really a great suggestion by this one respondent, that carrying your family with them is important. Now, you can also take that a little further, and sometimes people, and I remember when I was in my program, we would all get together and talk at night about who had the disease that we were studying of the week. So that you study a particular disease or disability, and suddenly you have it, or you think somebody in your family has it. So again, we're going to give you some strategies for learning balance with that. So that's really important. So the physical things that you carry are things that are going to make you feel better: snacks and chapstick, your phone, and that's in your pockets maybe, but on your shoulders, you might be feeling the pressure to really succeed and to do something that is going to be important and rewarding for you, and in your heart, carrying your friends and family, and that's a great thing. We always remember that. This morning, I was on a Facebook Live call with a colleague of mine who actually lives in Chicago, and we were next door neighbors. And I'm going to share this with you because she shared everything about me with her people on the Facebook Live or Instagram Live event that she did. One of the things that we really need to do is thank each other for the work that we do. And that you've heard all about hospitals and bringing food and all kinds of things to the staff. And so I was talking to her last week, and I was telling her about this series of webinars that we would be doing. And she owns this specialty grocery store outside of Chicago, and she said that she wanted to create something that people who want to support our healthcare providers would like to send to them. So she came up with a whole bunch of ideas for tea and all kinds of interesting things, which she put together. It's really going to be great. So I said, well, what are we going to call it? And she said, I think Serenity Now is a good name. And I thought also that was a great name. So we're actually starting with the next session. We're going to raffle off one of her Serenity Now boxes, and it will be sent right to your house. So we'll let you know how that's going to work in our next session, but you'll hear more about it. So I think that recognizing how people respond to us and saying thank you for keeping us in their hearts and their thoughts is really very important. So other people mentioned that they carry certain books, Bibles, pictures of fond memories. those are the kinds of things that give you balance, that when all is looking very gloomy, we remember that we're part of a much bigger picture in the world, which is why being out in nature is so very important as well. Carrying kids and friends and family, and again, trying to concentrate on the positive. I'll never forget after September 11th, and I know many of you maybe were born then or were very young, but I worked with Liberty Science Center in Jersey City, and they stayed closed for about 3 weeks. They actually were a holding place for first responders. And I remember that when the center opened up, they have a wonderful, on their first highest level, all of the greenery and the water animals and fish and frogs and who live in the area around Liberty Science Center near the Hudson River. And I watched a little girl holding a lizard in her hand, and just holding a lizard in her hand. And that's what it's all about. It's about being grounded and being a part of nature so that you realize that we are part of a much bigger picture, and grounding. And you'll get some good exercises to use for grounding as well. And so it's really important. So when you go outside for a walk, of course, making sure there's nobody within 6 feet of you, but walking along a stream and, walking in the stream if necessary or if it's appropriate. It's great for kids. It's great for adults as well. So, Jeanette, thank you for sharing some of these thoughts that people had. And I think it's a way, and I want you to continue to do that, to jot it down on a piece of paper, take it with you, think about the things that that you are carrying, because it's a great self-assessment. It helps you think about what physically you carry, as well as what emotionally and cognitively you carry as well. So I wanted to also, Jeanette, I don't know did we have any questions? Or?
Yes, Dr. Gaffney, this is Anne-Marie. We have a question, and we have some thank yous for the presentation, your wonderful presentation. So we have a very good question here from one of our participants who asks, what are the ways to tell your family that working at a hospital is part of your career? I understand their concern about my health, but it is my job and what I enjoy doing.
Actually, I think that you've actually answered the question with the second part of the last few words. I think, number one, to acknowledge their concern and to acknowledge their worries about you, and to say thank you to them. Thank you. I appreciate so much that you are thinking about me and concerned about me. But one of the things that I thought about before I made this as my career is the good I would do and how I could help other people. So just as the respondent said in the end of the question, but this is my career, this is what I want to do, this is what I've selected to do. But first acknowledging, exactly your appreciation for this family member's worries for you. I try not to use the word worry. I'd say concerns, thoughts, because you want to neutralize those things as much as you possibly can. The other thing that you can say is, we are very careful. We have a lot of rules and policies that everybody is putting into place, and we are working together as a team to make sure that we are all safe. So it's not only taking care of the patients, but taking care of each other. And I think that you just, every time that comes up, you get that response, again, acknowledging and thanking them and appreciating what they're doing. And they're going to ask a lot, by the way.
Yes, it was a great question, and thank you for that answer and affirming how this individual is handling it and giving us guidance. We are just about at a little over our time. It's 2:01. Do we have any last questions for Dr. Gaffney before we sign off? I see thank yous, and thank you so much. Donna and Millie, we thank you very much for your
You're welcome.
expertise and your time. Go ahead.
And there's our final slide. Let us know how you're doing. We're going to check in with you next time we have a session. And you can always reach out to us as well. And again, we're going to be starting to post different information. Yes.
I'm sorry, there's just one comment here that I was hoping you might take a moment to address.
Sure.
For our faculty who are on the line.
Okay.
The question is about what can we tell our students who are new to nursing and just entering into their first position?
About the difficulty of the work, about how challenging it is, or all of the above?
All of the above, and especially right now if they're feeling, nervous and scared and apprehensive about it.
Excuse me. I think it's always very helpful to look at history and to look at other times that have been very challenging for nursing, and how we've resolved how we've worked through those issues, and that we are standing on the shoulders of the nurses that came before us, who were really the trailblazers. And they too will be trailblazers. The important thing for them to know is there are always going to be people that they can turn to for help. They're faculty members, they're mentors when they're in the clinical setting. There will be clinical instructors, there will be other people who can provide guidance for them, and not to tough it out and ask for help. Let me give you one example from history. I went to school a long time ago, and it was, I can remember her name, but I won't mention it. I had a professor who was seriously an Army nurse, and it was about soldier on, forge ahead. And my grandmother was very sick and actually having surgery for an aortic aneurysm. And she thought it would be a great experience for me to take care of somebody with a similar diagnosis. And it wasn't a great experience for me because things have really changed quite radically. But at that time, I didn't think I could muster up the courage to tell her that I didn't want to be taking care of this person, that it was just really too hard for me. And so I want to leave you with a message that you always, if there's something going on, you need to talk about it. And just really be very clear that you don't have to push through, that by talking about it and asking for help and just processing it is the best thing that you can do. So for our nursing faculty colleagues, that means your door or your computer screen is going to be open probably more than other times because of the kinds of things that we're dealing with today. And just to know that these are moments in history that we will all learn from, that we'll carry with us for a long time, but they're going to inform and our profession and what we're doing as a profession. So we don't want to say this too will pass because it's rough right now, but always asking the question about meaning. What am I supposed to learn from this? And that's how I've always talked to my students, and I've talked to my clients about that. So I hope that answers the question, but it's something that we should revisit as we go through these sessions.
Thank you, Donna. And Dr. Gaffney, we thank you so much for your time and your wisdom, and also Millie. And we look forward to the next session, which will be next Monday, April 13th at 6 p.m.
Right.
And as you mentioned earlier, the session is on welcoming self-compassion, finding support, and self-care. So you've given us some tools that we may carry with us until then. So.
Okay, great. Thank you all very much. Thank you for listening. Take care.
Thank you. Thank you all for coming. Take good care. Bye now.